It was Friday. It was the last tank of gas I had to saw. I went to follow a big hemlock and didn't see anything hung up in the top of it. Watched the tree hit the ground, went to pick up my wedges and got blindsided by a snag. It was probably about 50 feet long, about 6 inches around where it hit me. Drove me into the ground. When I came to, I thought my arm was shattered. I tore a ligament in my thumb, chipped my elbow, and pulled a bunch of muscles in my shoulder, bruised my ribs, and ruptured 2 discs in my back.
Hope and physical therapy and patient care are very entwined. Oftentimes you will have patients that have had pretty severe injuries that become very depressed or very hopeless. And with our experience in seeing a number of patients in a number of different scenarios and situations, it's nice to be able to pull from historical patients and tell these patients, you know, I've seen this in the past, it will get better.
You can kind of get depressed from not doing anything, and she just kind of keeps you in high spirits and lets you know that you're going to pull out of this, you're going to be all right. And just takes that extra time to really show that she's here to help you, and I think that's really helped me out.
Lakewood Physical Therapy's approach to treating patients is very eclectic. We have some therapists that use a lot of therapeutic exercise. We have other therapists that do more hands-on, and we work with each other on treating these patients. When we have a patient that may not be responding to one sort of physical therapy, then we can collaborate with another therapist and figure out what's going to work best for them. I look at physical therapy as maximizing that healing rate. It's important for us to continue to motivate, monitor, and facilitate that process.
With my arm, it was probably, I had half the movement that I normally would have with my arm. Lifting no more than 15, 20 pounds. And after the 2 months working with Tina, my arm came back fully. I can do 50 push-ups, I can do pull-ups, my arm feels great.
All of the therapists I've worked with in Lakewood have those clinical skills and the technical expertise. They have a good relationship with the patients, and that's important. A physician wants to know when they're referring to a physical therapist that there's going to be a good working relationship with the therapist to get the results you're looking for and the clinical outcomes.
Lakewood Physical Therapy has a great staff. They're very personable, they're very open, they're a fun group. It's very important when that person walks in that door and they meet either Kathy or Mike or Jessica at the front. You know, they're always met with a smile, they're always met with open hands, and I think our patients really feel comfortable and at home and feel like a family here, and by the time it's all said and done, you know, these become our friends.
It's nice to see a bright smile every day saying, no, you're going to come out of this, just keep trying, you're going to be okay. I'm glad I came here.